Hi, this is Dr. Topper, Global Pharmacovigilance Director at Oracle Health Science Consulting. In this video, which is part of a series on case workflow and gaining back efficiencies through automations and small changes, we're going to be looking at medical review. Now, for a long time, medical review has stayed off from the automations realm. Yes, there have been automations available for it, but largely it hasn't embraced them. And that is because the medical review function is so critical to each company. This is the last time that someone within your company with gainful clinical knowledge of your products is going to be looking at this case. And then off it goes to report submission either to your co-marketers, your affiliates, your regulatory authority, etc. So it's a vital step. It's a very pivotal step. And most companies, rightfully so, don't want it to be completely automated. But there are automations that exist that can benefit you in gaining back some time, which then you can parlay over into the more serious or clinically based cases that require more time on a medical review. Look at the scenario where you have a lake of cases coming in front of the medical reviewer. Until the reviewer opens the case, he or she will not know how much time to spend on the case, because in essence, they're still assessing each case for the series criteria, each case for whether it follows a clinical narrative that is logical to the company, each case for the MEDRA hierarchy of terms and to be sure that the right MEDRA terms have been enabled. To look at internal IME list, important medical events list, to create a judgment call and upgrade the level of seriousness for that case, or to look at synonym list and create that coding one-to-one standardization that the company or the team have agreed on. So there's a lot of moving parts for the medical reviewer. And so they're putting the same amount of effort into each case, whether it be a serious case or a non-serious mature case. What if you had an automation that could do most of this, if not all of this, could do the synonym list coding, could do the causality, could certainly do the IME list, important checklist, check mark onto the seriousness of the case, and then brings it forward to the medical reviewer to simply say, look, I have done everything using your parameters in this automation. Simply look at it, check off on it, and send it along. That's less than the time it would take to do all of those things manually. And you certainly could see the logic of doing these on non-serious mature product cases where the adverse event profile has been known for quite a bit of time. And then you can utilize that excess time that you've saved and really put it onto the metrics of your serious cases. You may be able to do more serious cases. You may be able to spend more time on the serious cases. So either way you utilize that extra time, you've gained that from your normal workflow. This is Dr. Topper for Oracle Health Science Consulting. Do join me in the last and final installment of this series when we talk about report submission and automations. Thank you.